Zimbabwe, they are still doing trials. So we are still waiting for the homegrown data on how many patients have actually seen this effect and that effect. So, but mostly what we are seeing is the doctors who've been prescribing, most of the feedback has been on cancer patients reporting positive results in pain management. So I think there's more data that can be availed, I think probably from the Medicines Control Authority in terms of the testimonials that have been coming, but it's still it's still under research. So the prescriptions are based on dosages that have been approved for the specific product by the regulator. As you heard earlier, they are by dosage and it depends on the condition you're dealing with. If it's just for sleep, then you can't be taking high concentration. But if it's for a cancer patient who's in pain and who's trying to avoid your normal opioids, of course the concentration will be much higher, which is the dosage aspect. Yeah, so again, remember, it's a wellness product. It's a complementary medicine that works with other medicines. So with your normal, what you're allopathic medicines, where they actually have standards for prescription, so you're given a course. But with these CBD oils, even if you're not sick, it's a wellness product like vitamins and so on. But of course, with patients with specific conditions, we'd have to then recommend how they should take it, for how long, and when they should finish. Currently, yes, cannabis has been known more for its recreational properties, in the spiritual, cultural, and just for leisure and pleasure. But of course, in recent years, after actually learning from indigenous knowledge systems across the world, Africa, India, that cannabis has always been part of the therapeutic or herbal medicine, but it has now been mainstreamed into science and the mainstream medical industry and now the pharmaceutical industry, where it has been scientifically proven that it has some therapeutic benefits for conditions such as pain management in patients with cancer and other terminal illnesses. So the demystification, I think, for the ordinary person will only be done with continuous education and awareness and a lot of interface, and I think across the board, it just doesn't have to be the urbanites, but I think even the rural community has to be educated about cannabis as a medicine and not just a recreational herb. There are a number of challenges, some that are beyond the government, some that are beyond the private sector. But the main issue is that the market for cannabis is not as big as people thought. Everyone thought Zimbabwe is going to be exporting into Canada, into the West. They also have their own cannabis. It's not like diamonds. So the best way is for us to develop a local market, a local industry, like what these few companies are doing, making Zimbabwean products, selling them locally. And then if you are trusted, you can then actually export. So the major issue that has been a bottleneck to the people with licenses who are not using those licenses has been funding. There is no funding for cannabis projects. Our local financial institutions struggle to actually find space because of the tagging, the risk aspect. These things are cannabis. They actually don't fund those kind of projects. Then you talk about technical expertise. Sometimes you have to import the skills that know how to set up these facilities because of the compliance, the standards, the regulation framework. And then you also have issues to do with